So we started doing this last Friday. What that has meant is that Tuesday, Wednesday and Thursday. Tuesday we had appointments available till 2 o'clock in the afternoon. Wednesday we had appointments available to midday, and yesterday we had appointments available to midday. Today, once again, they've gone up till 2 o'clock with appointments available. So we are seeing that small tweaks that we've made, now that we've turned our focus on this 100%, have actually produced the result that we've wanted. And we are I have now put in a task force that meets once every other week to continuously make these improvements so that when a person calls, because as you say, one complaint that I get consistently is that there is a lack of appointments in the health centre. So we are now going to meet once every other week with a task force to do small changes that actually produce big results.
OK, now last year you announced to great fanfare that a building had been identified in town for the community mental health facility, and then we found out actually that building was no longer going to be used. We're still waiting for an update. Do you have one?
Yeah, so I'm not saying that that building is not going to be used. What I'm saying is that there has been an alternative building that has also been offered, and we are weighing up the choices between the two of them. So we are currently in the process of looking at the viability of the other building, which I actually think is better, which I actually think has better external facilities, which I think is more accessible. And we're weighing up the pros and cons of each.
I must ask you about false negative smear tests. Has been referred to me as well as being an issue. Are you tracking how many false negatives there are?
We are. So we have a gynecologist who is specifically tracking this issue, and she is meeting regularly with the Director of Public Health to keep track of this.
Could we get some information on that at some point down the line?
As soon as the statistics are ready, I think that we need to reach out.
And there needs to be a very big focus on improving the basics, so communication, digitization of the records, IT systems. All this needs to be kept up to date, maintained, and also improved, because that is where the patient experience comes from.
And the communication.
Exactly.
So I think we're at 70% of the digitization of the records.